As a follow-up to the message I distributed last week, I would like to acknowledge that, in my attempts to create calm and decrease the media frenzy, I may have miscommunicated my intended message. The sole goal of my original statement was to try and decrease fear and misconceptions. I feared that the media may have painted a picture of the situation that was not quite accurate, with contradictory numbers being provided by BC EHS and Northern Health. I would like to recognize that we have a COVID-19 crisis in our community that is overwhelming the frontline workers, and we need to support them in a meaningful manner. The Council and District of Fort St. James staff wish to convey our sincere appreciation of the efforts of the hospital staff, the nurses, aides, lab, and x-ray techs, and staff in the kitchen, administration, and maintenance, who can place themselves in the path of COVID-19 on a daily basis, and who need to protect the long-term care patients from the virus. At a local level, we know that our 2 ambulances were overwhelmed and needed outside help. We clearly have a large number of cases in Fort St. James and all our outreach areas, including the district, Tachi, Binche, and Nacosly, and this has led to great strain upon the frontline medical system. I never wish to send the message to anyone that the COVID-19 situation in our community is not a big deal. It is. It's a serious situation. We send our heartfelt condolences to those who have lost family members to this condition, and to those whose loved ones are still in hospital. We all hope for a speedy recovery. I know that Nacosly, Talasdan, and Binche First Nations are each struggling with COVID-19 cases, and it was never my intention to make the challenges they are facing any more difficult than they already are. The most important issue is for us to all stay safe, and I wish to remind everyone, keep a small family group bubble and avoid close contact with elderly and other vulnerable individuals. Keep up with social distancing when outside your family bubble. 2 meters is good, 3 or 4 meters is better. Wear a mask in public buildings and when approaching others on the street. Wash your hands and clean surfaces regularly. Be kind to others and assist those living in isolation. My layman's attempt to allay fears sent the wrong message to some people. However, it exposed the significant level of concern that many in Fort St. James now have. As it is clear to me now that the number of COVID-19 cases in the community is likely to continue to increase, I have asked Councillor Paul Stent to commence providing a weekly COVID-19 report to the community, and as our medical expert on council, Dr. Stent will be making all future COVID-19 public comments on behalf of the district. Thank you.